Welcome to this video on newborn care. In today's lesson, we'll be focusing on a very important task that every parent or caregiver needs to know: how to burp a newborn baby. Burping helps release air bubbles that babies swallow while feeding, and it can prevent discomfort, gas, and even spit up. Let's get started. First, let's talk about why burping is important. Newborns tend to swallow a lot of air when they eat, whether they're breastfeeding or bottle feeding. That trapped air can make them feel full or uncomfortable, and in some cases, it can lead to fussiness or even crying. Burping helps relieve that pressure and keeps your baby comfortable and content after feeding. Next, let's cover when you should burp your baby. Generally, it's a good idea to burp them halfway through the feeding session and again at the end. If your baby is breastfeeding, you can burp them when you switch breasts. If you're bottle feeding, try to burp them after they've consumed a few ounces, or about halfway through the bottle. Of course, every baby is different, so if they seem fussy or uncomfortable during feeding, you can always pause and burp them earlier. Now let's get into the different positions you can use to burp your baby. There are 3 main positions that work well, and I'll walk you through each one. Position 1, over the shoulder. The most common method is holding your baby upright with their chin resting on your shoulder. Support their head and neck with one hand while using the other hand to gently pat or rub their back. Make sure to keep a cloth or burp cloth on your shoulder to catch any spit up. Position 2, sitting up on your lap. Another option is to sit your baby upright on your lap facing outward. Support their chest and head with one hand, making sure their chin is not tucked into their chest. With your other hand, gently pat or rub their back. This position is great because it helps keep their airway open. Position 3, laying face down on your lap. The third method is laying your baby face down across your lap. Support their head so it's slightly higher than their chest, and use one hand to pat or rub their back. This position can be especially helpful if your baby tends to spit up more often. Now that you know the positions, here are a few tips to make burping more effective. Use gentle but firm pats or rubs on your baby's back. You don't need to be too forceful. Slow and steady usually works best. Sometimes it may take a minute or two for the burp to come out, so be patient. If your baby hasn't burped after a few minutes, it's okay to continue feeding and try burping again afterward. If your baby doesn't burp every time, don't worry. Some babies don't swallow as much air and may not need to burp as often. As long as they're comfortable, feeding well, and not showing signs of distress, it's perfectly fine. However, if your baby seems fussy or uncomfortable after feeding, or if they have a tendency to spit up, you may want to try burping them more frequently during feeds. That's it for this lesson on how to burp a newborn baby. Remember, burping is a simple yet important part of feeding, and it helps keep your baby comfortable and happy. With a little practice, you'll be able to find the method that works best for your baby. Thanks for watching, and we'll see you in the next lesson.